team of British cancer specialists says a new form of personalised treatment is producing promising results in adults with leukemia. Now, the procedure, called CAR-T therapy, involves reprogramming a patient's immune system to attack cancer cells. The research at University College London and University College London Hospital may offer hope to patients for whom other treatments have failed. Our medical editor Fergus Walsh has that story.
Coming out of the deep freeze, a new frontier in cancer treatment. Phil has been living with leukemia for more than 20 years.
Feeling okay?
Fine, yeah.
Inside this bag are his own immune cells, which have been genetically engineered to fight his cancer. And now, drop by drop, are being infused back into his body at University College Hospital, London. All other cancer treatments have failed to stop his leukemia returning. CAR-T is his best hope.
It's a living drug inside me now. It's a medicine which lives in me, and it just replicates inside the bone marrow. Every time it sees a sort of cancer cell, zap. That's
Fingers crossed.
Fingers crossed, yeah.
CAR-T stands for chimeric antigen receptor T-cell therapy. Part of the patient's own immune system, their T-cells, are removed from their blood. In a laboratory, these cells are modified. A gene is added to enable them to recognize their own cancer. This army of T-cells is multiplied and then infused back into the patient. A new protein on the surface of the T-cells locks onto the cancer, earmarking it for destruction. CAR-T therapy is part of a revolution in cancer treatment, which harnesses the power of the patient's own immune system to tackle their disease. There is a long way to go, but increased understanding of the genetics of cancer is delivering more and more targeted therapies with better outcomes. CAR-T is already available on the NHS for leukemia patients up to the age of 25, but not for older adults because it's proved too toxic. Scientists at University College London have refined CAR-T to reduce side effects, and after more trials, hope it will be licensed for older patients.
It's absolutely transformative, probably the biggest breakthrough in the last 20 years in malignant blood cancers. It's just an absolute delight to be able to offer new therapies to these patients who otherwise, have no treatment options available to them.
I think it's called watch and wait.
Claire from Hampshire had CAR-T therapy 2 years ago after standard leukemia treatment failed.
As long as everything goes okay, the biopsies become less frequent.
She's still in remission.
I don't think I'd be here if I hadn't had CAR-T. I was very, very lucky that the trial was there at the time. So if the CAR-T option hadn't been available, I would have had probably a finite amount of time left.
In years to come, CAR-T may be able to treat tumours in the brain, prostate and liver, giving more cancer patients like Claire and Phil a brighter future. Fergus Walsh, BBC News.